Welcome back to another edition of Get Well Acadiana with Dr. Kevin. Thank you for joining us on the show today. Welcome to the show that's designed to change your life and to change your health for the future. And I'm so glad you all are listening because your health is the most important thing that you'll ever have, because without it, everything else stops. You can't make your house payment. You can't play with the grandkids. You can't go for walks with your spouse. Whatever it is that you enjoy requires that you keep your health in good shape. So that's what this show is designed to do. So thank you for joining us. I'm here with my co-host and producer and good friend, Brandon Como. Brandon, how are you this morning?
I'm doing well. I'm really looking forward to today's topic. You were talking about it before the show, and this is definitely an area that affects so many people here. And so I'm really looking forward to hearing what you have to say about it.
It is. I was telling Brandon off air that we're shifting gears a little bit on the show today. Normally we come on here, for those of you that are just catching the show for the first time, and we talk most of the time about chronic disease, and we discuss solutions to more systemic things like thyroid problems, hormonal problems, and diabetes. But today I want to shift gears a little bit and talk about something that is the number one disabling thing in America in people over 50 years old, and that is spinal problems. And spinal problems are the number one disabling thing in adults because, first of all, no one ever knows to take care of their spine throughout their whole life. So we're going to get into all of that, and we're actually going to spend all month long on spinal problems. We're making February Spinal Health Month at Bryant Wellness, and we'll be discussing this on all 4 shows this month. And then I'm going to be hosting a free community workshop on February the 21st called 5 Secrets to Solving Your Pain for Good. And it's going to be an amazing workshop. And we're going to address the latest advancements in drug-free, surgery-free pain relief for all types of spinal issues. And I'm talking discs, stenosis, spurs, arthritis, sciatica, all of that whole gamut of spinal problems. We're going to be going through it all month long. Now, the workshop is going to be at the Hilton Garden Inn across from the Cajun Dome, right down from the station here. And so if you have spinal problems or any kind of disc issues, or if you were told you need surgery, or maybe you've even already had surgery that's failed, this workshop is for you. But the reason that spinal conditions are the number one disabling thing, I can really sum that up in one paragraph. So, Brandon, if I took 10 people, just random people off of the street, and I asked those 10 people, do you have a dentist? Do you have somebody that takes care of your teeth? Or if you had a toothache, do you have somebody that you could go to or somebody you could call? All 10 of those people would say, well, of course, I've got my dentist office right here on my cell phone. He's programmed into my phone book. But if I ask those same 10 people on the street, who do you have that takes care and maintains your spine over your lifetime? Who do you go to for regular spinal maintenance? And who do you go to for spinal checkups every year? They look at you like you're from another planet. And so for some reason, we just have this idea that our spine takes care of itself, and it does not. And that's why so many people have problems. Dentists did a really good job of teaching people that their teeth is something that needs to be maintained and taken care of. And, Brandon, remember when we were kids? Well, I know when I was a kid, I know I was a kid a little bit before you. But when we were kids, the dentist would come to the school and they would have us chew this little pink tablet. Mm-hmm. I don't know if they did that when you were a kid or not.
No, but I've heard stories.
Yeah, so they had this little pink tablet, and all the kids would have to chew it, and it would show you where you weren't brushing your teeth good. I know some of you out there remember that. And so the dentists have done a really good job teaching people that you got to take care of your teeth and maintain them. But what about the spine? The spine is not something that just sort of takes care of itself throughout your lifetime, but we don't ever think of it that way. It needs maintenance throughout your entire life, from the time you're born all the way up till today. Your spine should have been maintained and checked and treated and taken care of, and that probably didn't happen. And then you add to the equation that we abuse our spines literally from the time we're born. Coming through the birth canal is literally our first case of whiplash many times. And that's why you see me posting all these Facebook posts of me treating the little babies for spinal problems. And when they have spinal problems, they're uncomfortable and they're colicky and they're whiny, they don't sleep well. And you can tell they're uncomfortable. And when you start to treat them and take pressure and relieve pressure off of them, all of a sudden they feel better and sleep better and stop crying so much and digest their food better. Brandon, I don't know if you know this, but I first treated my son when he was about 7 hours old.
Oh, wow.
Yeah, and it was funny. We were in the hospital, and as soon as the doctor left the room, I had somebody watch the door. I was over there treating him, watch the door, make sure he's not coming back. And I was over there treating my son. Yeah. He's my son. I'm going to do that. And so, the earlier, the better. Mm-hmm. But yes, coming through the birth canal is our first case of whiplash. Many times, and you guys ever seen a baby that's just born? Many times their head is smashed. They got scars on their face. Their face is all bruised from coming through the birth canal. Imagine what that did to their little spines. And so absolutely children and babies need to be treated and have their spine checked and taken care of. And then you add to the equation, according to studies, the average child falls 200 times just learning to walk. I mean, imagine if we fell 200 times over the next year. Personally, that seems a little low to me. I don't know what study that's from. I think Creed fell 200 times a day when he was learning to walk. 200 times doesn't seem like, that seems a little low to me. And then you add up the skateboard accidents, the bicycle accidents, wrestling with cousins, falling out of tree houses. And then they get big enough to start sports. You have football, baseball. And then as a teenager, they start looking down at their phone all the time, which creates this terrible head forward posture. And then they start driving with all the accidents. And then in their 20s, they have several other traumas. So it's literally a lifetime of little physical traumas that we get to our body that never get addressed. The average patient that's 40 years old, according to studies, has had 1,000 physical traumas to their body that they did not address because they didn't think it was a big deal. So it's not one thing. It's all of these little things that add up that's the issue. And so many times patients go, I can't think of anything major that I've done to my body to cause all of this. But we actually walk them all the way through all of these little 1,000 physical traumas, starting from birth, then learning to walk, and then, the recess accidents and falling off the swing and, the bicycles. And there's 1,000 little physical traumas that need to be addressed, and they never do. And then when they're 40 years old, they come into me and they say, I have no idea how I got this way. And they don't think about all these little things that have added up. Now, it would be like, imagine back to the dental analogy. And so when patients come in and they say those things to me, it would be like being a dentist in a town that did not have toothbrushes, did not have toothpaste, no one had any mouthwash, and had never been to the dentist, and then they've abused their teeth from the time they're born. Like maybe they eat candy right before bed every night, and they went to sleep with sugar on their teeth. If they had any teeth left at 40, it would be a miracle. And that's what I deal with in the field of spinal health care. People abuse their spines from the time they're born. They've had nothing done to it or never maintained it, and then they blow out a disc or they develop arthritis at 40 years old. So my point with all of this is this. The spine is something that needs to be maintained and treated and balanced and taken care of our whole lives. And that did not happen. And that's why spinal conditions are the number one disabling thing in America in people over 50 years old. So we're going to break all of this down all month long on Get Well Acadiana. Every aspect of spinal and structural and disc problems. We'll talk about sciatica and stenosis and arthritis and spurs and degeneration and, disc ruptures and herniations. And we'll go through spinal surgeries and what all's involved with that. So we're going to spend all month talking about spinal health because February is Spinal Health Month. And then I'll be following all of that up with an amazing community workshop on February 21st called 5 Secrets to Solving Your Pain for Good. It'll be at the Hilton Garden Inn across from the Cajun Dome. And if you want to register, it's 837-7174. And this one's going to fill up quickly. So, I hadn't even really talked about the workshop too much yet. I'm going to do that in the second segment. But if you want to make sure you can get in, you may want to go ahead and call and register. It's 837 7174. And if you know somebody out there that's suffering with spinal or disc problems, give them a call or text them right now and tell them to tune in. You may just change their life with this information that I'm going to go through today on the show. Now, on the second segment, right after this short break, we're going to specifically dive into the spinal disc. So don't go away. We'll be right back. Welcome back to Get Well Acadiana. I'm Dr. Kevin, and we are discussing spinal and structural problems on the show today in February's Spinal Health Month at Bryant Wellness. All month long, we're going to talk about structural and spinal and disc problems, and we're going to get into every aspect: spurs, arthritis, stenosis, sciatica. I mean, anything that deals with spinal or structural problems. We'll even get into a little bit of foot and knee problems and knee arthritis, because all that's interconnected. The body's all connected. And I'm going to follow that up with a huge workshop on February 21st called 5 Secrets to Solving Your Pain for Good. And listen, I don't care how bad you think it is or how hopeless you think your case may be or how unfixable or unsolvable you were told your problem is, there is still hope for you. There's almost always something we can do, and if not solve it, to at least curb it some, so that you can get your life back to some degree. And we're going to talk about some amazing new research and some of the latest breakthroughs on non-surgical spinal solutions and disc issues. And the spinal disc is something that we're all familiar with. We've all heard people say that they have disc ruptures or disc herniations, and many of you out there may have even been told that yourselves. And we have the absolute very best non-surgical solution for disc problems, and I'm going to get into that now. But before I do, I have to begin my talk on disc problems with this. I honestly think that there's been a little bit too much emphasis placed on the spinal disc as the end-all, be-all answer for spinal problems. Thinking everything is the disc is almost, man, I hate to say it this way, guys, but it's almost outdated thinking. That's kind of 90s and 2000 technology. And I'm not saying that disc problems don't occur, because they definitely do. Don't misunderstand me. And when we talk about disc problems, there's a lot more involved to it than that. And the research is saying this as well. There are other things that contribute to spinal and structural problems that were blamed on the disc, that we later found out that the disc was only part of the larger complex of what's going wrong. And that's what I really mean by that. Just looking at the disc as if I fix the disc, everything's going to be okay, that's really outdated. And all the research is backing me and is showing that as well. And, I've been saying that for quite some time, that there's a whole complex involved, and you have to look at the whole complex. So I have to preface my talk on disc as to saying that I think that the disc is part of the problem, but there's a lot of other things going on as well. And the way that we determine if it's truly a disc or not, or if there's a whole complex of things going on, is, in addition to MRI, is we do something called motion study radiography. And here's what I mean by that. Well, here's the problem. The problem that I have with MRI is this. The bone that I have to pick with solely relying on MRI for spinal problems is this. If anyone out there listening has ever had a spinal MRI, or maybe you know someone that has, remember the first thing that they told you during your MRI was to lay down and don't move. Now, your spine and your structure are designed for two things: being gravity bearing and being in motion, meaning that you're upright, you're on your feet, weight is pulling down on you, and you're moving around and in motion. So why would we want to take the structure that's designed for gravity bearing and moving around and have the patient lay down and not move to view what's going on with them? I will never understand that. So when they tell you to lay down and not move, they're taking gravity out of the equation and they're taking motion out of the equation. And so the way that we add those two elements back into the patient's evaluation is we do what's called gravity-bearing motion study radiography, which simply means this. We do plain film x-rays with you standing up, first of all, and then we have you flex and bend and move, and we x-ray those movements. Now we can see something that MRI doesn't show, and that is function. And all of the new research for spinal care and for spinal problems is going towards function and away from structure, meaning the way it structurally looks is becoming less and less important, and the way that it functions, meaning the way it moves and bends and works, is becoming more important or showing that it's more of an issue. So let me explain that. Structure is the way. So structure means the way something sort of looks whenever you view it. But function means the way something works or bends or twists or flexes. And all of the research is showing that if you restore the function, it is as important, if not more important, than restoring structure. So what I mean is this: if you fix the disc, but you don't restore function because you never looked at function, the patient's not going to get better. Now, you have to actually do both. So doing both means let's restore the structure and the function. Now we have a healthy patient. And that's what our spinal program is all about, is restoring structure and function and stabilizing all the surrounding tissues to hold that structure and function in place for the long term. Now, ladies and gentlemen, we're able to really solve complicated spinal problems by doing both. You can't just treat the structure, which in the surgical world is plates and screws and hardware in the spine, fusions. And if the problem is with function and you're working on structure, you're not going to get there. Plus, now you have a ton of scar tissue, which is a great source of pain in itself, which we're going to talk about. We're going to talk a ton about scar tissue all month long. But when you take a patient and you restore their structure through our DISC program, and then you can restore their function through our functional correction program, now we have a complete picture of what a healthy patient should look like upon being released. And we'll be talking about these concepts all month long in February, because February is Spinal Health Month at Bryant Wellness, and I'm going to be following that up with a workshop on February 21st called 5 Secrets to Solving Your Pain for Good. It's going to be held at the Hilton Garden Inn, right across from the Cajun Dome. Everyone's invited. If you or a loved one is suffering with any kind of spinal problem, whether it be disc problem, spinal stenosis, hyperkyphosis, which is this big forward rounding in the upper back, it's a terrible thing to have, or whether it be sciatica, whatever it's been labeled, this will be the most comprehensive spinal program that you've ever been to. And you will leave there with the best understanding of the latest natural solutions to spinal problems. Each participant will also be given a $200 certificate toward our spinal assessment program. And it's just going to be a great time, fantastic workshop. So if you want to register, you can call my office at 837-7174 and just say that you want to register for our February 21st spinal program. My staff will call you back Monday to give you the details and to get you on the list. And this one's going to fill up quickly. So I think we only have room for about 45 individuals, and I know it's starting to fill up already. So it'll be simple things you can do at home. So you're going to learn things you could do at home to help take better care of your structure and your spine. We'll talk about, some simple home exercises and some lifting things that you can do. And we're going to have a section in there that we call the worst of the worst. Now, that section in the workshop called the worst of the worst is going to be the severe sciatica, the spinal stenosis, those that have had failed back surgery. There's a whole section in there that we call the worst of the worst. So I don't care how bad you think your problems are in the spine, we have a section in there that will address your exact concerns. So it's 837-7174. That's 7174. Call now if you want to attend. Now, if you want to take Dr. Fontenot's seminar, and it's the exact same seminar in New Iberia, that number is 367-2567, or you can simply text the word pain to 77453, and your number will pop right up on my computer Monday. Simply pick up your phone and text the word pain to 77453. We'll get your number to pop right up on the computer, and we'll call you back Monday and go through all the details with you. Now, we're going to get into a few of the intricate details about the spinal disc when we return. So don't go away. We're going to be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for coming back with us. And we're discussing spinal problems on the show all month long because February is Spinal Health Month at Bryant Wellness. And we're going to discuss all aspects of spinal and structural problems. And I'm going to be following that up with a community workshop on February 21st called 5 Secrets to Solving Your Pain for Good. Now, before the break, I was talking about an MRI, and that although that gives us great information about what the soft tissue looks like, it's not the only answer, because that's sort of outdated thinking, because they have you lay down and not move. And that takes gravity and motion out of the picture, and your spine is designed for gravity and motion. So why take the two most important elements out of the equation, and let's try to figure out what your spine is doing? So we add those back in with these gravity-bearing motion study radiography that we do. And each participant that comes to the workshop will be given a $200 certificate that will actually cover their gravity-bearing motion study radiography. So the neat thing about it is if you come to the workshop, you'll actually get a certificate to cover that test so that we can see what's going on. But what that means is we add those two most important elements back in. We get you gravity bearing, and we have you move around, and we x-ray while you're moving around. And I can tell you guys, when I put the x-ray up that shows you bending and moving and flexing, and you see how your structure works on the inside and what's not working, it's a pretty neat thing. You don't even have to be able to read x-rays to see this. I can stick this up and ask you, show me where the problem is. And you can almost do this yourself, because you can look and see what's working and what's not working on the inside of your body. So this is really a cool thing. You don't even have to take my word for it. You can look at the x-rays and it's pretty obvious. And so function is as, if not more important than structure. Now, the next thing that I wanted to talk about is surgery. And although spinal surgery is sometimes necessary, people should exhaust every option before undergoing such a aggressive procedure. Sometimes people just sort of get lulled into this attitude that, I'm going to ignore it. If it gets bad enough, I'll just go have surgery and fix it. The researchers from the Cincinnati College of Medicine reviewed records from 1,450 patients who were diagnosed with spinal problems. After 2 years, just 26% of the patients that had surgery returned to work. 26%. That's compared to 67% of the patients who did not have surgery returned to work. Now, I'm going to show you a technology later on in the show to where it's up to 90%. We can get that patients who return to work, we can get it up to 90%. So this attitude that I'll just ignore it, and if it gets bad enough, I'll just go have surgery, you're rolling the dice, and you got 1 out of 4 chance of ever being able to return to work with that. So you really want to be proactive and try to handle things before it gets that bad. Now, if that was the case and you have already had spinal surgery and you're still having problems, don't worry. We have a post-surgical program that is pretty remarkable, and it's obviously a lot more difficult if to take somebody who's already had surgery and to try to get them better. But if you're listening and that's you, and you have already had spinal surgery and you're still having problems, I want you to know we have a whole section for you in the workshop, and it's some pretty cool stuff. We call it failed back surgery syndrome, and we have a treatment protocol for that that is pretty remarkable. I mean, our success rates are pretty good on that one. So, every day, thousands of Americans are falling victim to this spinal disease. Millions of people out there are suffering with spinal problems. I mean, whether it be sciatica or, any other arthritis, any of these other things, millions are becoming dependent on pain medication. And Brandon, this is the one thing that just gets to me. Guys, this opiate addiction problem that we have in America, I don't even have to tell you how bad it is. And so taking these opiates is such a bad idea. And I know, listen, I know if you're doing this, I know you're just trying to have some quality of life. And so many of these terrible addictions are avoidable if we would just do natural solutions to get people out of pain instead of the first thing we do is give them pain medicine. And the pain's not the problem anyway. The pain is just a symptom of something going wrong in the body, of damage being done. So pain is like your check engine light coming on your car telling you there's a problem. It's not what's wrong, but it's telling you something is wrong. It's whatever tissue that's being damaged in your body eliciting that pain response in the first place is where the problem is. So all of these millions of people that we've addicted to these opiate medications for treating something that's not the underlying issue in the first place, man, that's such a tragedy. It's such a shame. And listen, I want you guys to understand, if this is you, if you're dependent on opiate medicine, I want you to know that our office comes with zero judgment, zero looking down our nose at you. We will find a pathway for freedom for you. And it starts by fixing the underlying things in your body that's eliciting the pain response first, then working on the dependency. Because if you're in severe pain, it's going to make you're reducing that stuff that much harder. And I've got a great guy that I can work with that handles the dependency part for you. But we come with zero judgment, and he does as well. So if you can hear the sound of my voice and you really want to get where you need to be, I want you to know we are here for you at Bryant Wellness. Now, as far as the spinal disc goes, I want you guys to know that these terms get thrown around all the time, and they don't really mean much in the medical world. I mean, these terms like herniations, ruptures, discs, slip discs, all of these are real layman's terms and are so interchangeable. It's really hard to know exactly what you have going on in those sort of terms, because someone might say they have a rupture, but they actually have what's, commonly known as a herniation. So the terms that we use for the different levels of disc problems, we have 4 different levels of disc problems. And the bottom of that, the simplest one, is called disc degeneration. So if you look at the disc kind of like a jelly donut, there's a soft core, there's a soft inside, and a real tough fibrous outside. And what disc degeneration means is that the jelly donut is starting to get a little weak, and the jelly's kind of starting to come through the side. It's not out yet, but it's kind of starting to come through. That's kind of the beginning phase. And the next step up is what we call prolapse. Prolapse means that the side of the donut is starting to get a little bulge in it. It's kind of starting to show. You can see where it's sticking out just a little bit. And then the next step up of that is that the jelly is now sort of leaking out of the side. That's called an extrusion. The medical name for that is a disc extrusion. And last and worst of all of these is sequestration. Sequestration means that part of the jelly has broken free is now floating around your spinal column. That is an emergency surgical case. Now, the first 3 are treated non-surgically in our office. So the fourth one, called sequestration, if you have sequestration and that's what you had, the doctor's office is supposed to immediately rush you to the emergency room, and you would have emergency spinal surgery. And the reason that I'm bringing this up is because if you've been to the doctor's office and you told you had disc problems, but they didn't rush you to the hospital, that means that you have one of the first 3, and that means it's totally treatable with our program. So many times patients will come in and say, well, I have 2 herniations and 3 ruptures. That doesn't really tell us a lot medically because those terms are so interchangeable. So we have to know exactly what we're dealing with. And many times, if it's those first 3, our disc protocols work really, really great for those. And if it's that fourth one, you would have already probably been rushed to the emergency room and had emergency surgery anyway. And if you have, then that's a whole different treatment protocol. Now, before break, real quick, I wanted to tell you about one other amazing advancement in the treatment for spinal disc, and that is spinal decompression. Now, decompression was researched by some of the world's leading medical doctors, and I mean world's leading. And they found that disc decompression was one of the most effective treatments for disc problems ever. And this is in all caps, when done correctly. And that's a big one because so many times it's not. Now, these doctors are no slouches, the ones that did this research. One of them is Dr. Norman Shealy, who has a double doctorate, MD, PhD from Harvard Medical School. And he was one of the researchers who did this study on decompression. The other one was Dr. Krimchek. Dr. Krimchek is the country's top orthopedic surgeon. So if I'm Peyton Manning or if I'm Drew Brees and I need a shoulder operation or I need a neck operation, Dr. Krimchek is probably going to be the one that does it. If I'm a major league pitcher and I need shoulder surgery, Dr. Krimchek's probably going to be the guy that gets the call. And so he's really the country's top, if not the world's top orthopedic surgeon. And the third researcher was Dr. McClure, another world-renowned researcher also from Harvard Medical School. Now get this. These doctors looked at all of the research on decompression. And what they found is when done correctly, and that's the most important, 92% of the patients got well and avoided surgery. And after 2 years, that percentage was still 86%. 2 years later, 2 years after decompression, 92% of the patients that had correctly done decompression got better with their disc problem. That's remarkable. They found that it was the most effective thing for spinal discs they had ever looked into when applied correctly. No other treatment can even come close to that, guys. No other treatment can even come close to half of that. Remember, with surgery, only 26% return to work. Now, here's the question that I get all the time. Well, Doc, I know you're doing decompression, but can't I just use my teeter hang up and hang upside down? Like that's pulling as well, right? Here's the difference. And I get a lot of questions. People ask me all the time about the teeter hang ups. And traction, or you hanging upside down, is a constant force and a constant direction. And the problem with that is that traction causes a contracture of the surrounding muscles, and it actually increases interdiscal pressure. Now, I want you guys to remember, okay, so we have a jelly donut, and the jelly donut is squashed, and the jelly's coming out of the side. Now, if I could grab the top and bottom of that jelly donut and pull it apart, could you see how the jelly would be sucked back in? That's what decompression does, basically. And so when you're hanging upside down, it pulls all of the spinal segments equally so that it diminishes the results. And it also straightens out the spinal curvatures, which is not a good thing, especially when you have disc issues. So this is not a teeter hang-up. Now, by the way, while I'm on the subject of teeter hang-ups, because like I said, I get tons of questions about this, if you have absolutely no spinal problems whatsoever, like you have nothing wrong with your spine and it's in perfect shape, hanging upside down for a few minutes a day has great benefits as a maintenance tool. But if you have spinal problems, it can become very risky. It may help you temporarily when you do it one time, but you may do it another time, you may blow it out because it increases interdiscal pressure. So it may help you the first 3 or 4 times, but you may hang upside down one time, and if that disc is a little bit compromised that day, you could really hurt something. So if you do have spinal problems, the hanging upside down is not the best idea. Now, if you have no spinal problems, then it has lots of great benefits, and it's actually very beneficial. So decompression is a single disc specific treatment, meaning that I can target each individual disc and its surrounding musculature alone. So you don't get this contraction, which is very bad for the spinal discs and muscles. And the best way that I can describe decompression. So everybody's seen on the movies where the window breaks on the airplane, everything flies out. That's because there's less there's a vacuum. Now, if you can turn that vacuum around and make everything fly back inside the plane, like if the pressure was greater, it would change that around, and that's exactly how decompression works. Now, or even take the jelly donut. If you smash the jelly donut, it comes out the side, and then if you could pull it apart, it would go back in, and that's kind of how decompression works. Or I've got another one. If you ever squeeze the toothpaste tube and you got too much out, so you squeeze it the other direction and suck the toothpaste back in, that's what decompression is. Now, of course, there's a science to it, but that's the bottom line. That's the theory of it. Now, here's the neatest thing about this whole decompression thing in your body. The disc will actually form a little scar tissue patch where the herniation was, and that little scar tissue patch will be stronger than the whole rest of the disc, so it will never bulge in that area again. And here's one big caveat with this whole thing, and I can't emphasize this stronger: when done correctly. There's a lot of people doing decompression therapy out there. Not all of them are licensed, but we are, which means that we've passed rigorous board exams on the proper application of this technique. And there's a lot of places doing decompression, but listen, I've seen patients put on the machines backwards. I've seen them settings wrong. I've seen the computer angles wrong. I mean, I've seen some real disasters with decompression. So my point with that is this: even if you've tried this once and it didn't work for you, or maybe it worked and then it came back, it may not be that decompression failed. It may be the application of it failed. And on February 21st, I'm going to be hosting a free community workshop on all of these spinal problems: stenosis, discs, failed back surgery syndrome, scoliosis, all of that. And if you want to attend, all you have to do is call my office at 837-7174 to sign up. And I think we have, 40 or 45 seats available. So you want to call right away. This one's going to fill up quickly. It's 837-7174. And in New Iberia, their number is 367-2567. Just leave your number on the machines. It's called 5 Secrets to Solving Your Pain for Good. Or you can simply text the word pain to 77453, and your number will pop right up on our computer. That's pain, PAIN, to 77453. It's going to be at the Hilton Garden Inn, February 21st at 7 p.m. Now, when we get back from break, I'm going to tell you about another remarkable advancement for spinal conditions using laser techniques. So make sure you come right back after this break. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining us after the break. Now, right before we left for break, we were talking about the amazing benefits of decompression therapy. And what I wanted to kind of get across to you guys is that there are always a complex number of conditions surrounding someone with spinal problems. It's almost just never one thing. There's usually some disc involvement. There's some scar tissue involved. There's usually inflammation in the area. There's maybe even some degeneration in the cartilage or some lack of cartilage. So there's generally a complex series of things going wrong. And you can't just treat one thing and expect it to get better, because the body's too complicated for that. There's always a series of what we call co-causes. And the 5 Secrets, a workshop that I'm doing called 5 Secrets to Ending Your Pain, is generally these 5 co-causes that we find. And so we're going to be getting into that at the workshop and all month long on the show. Now, I went a little long in that last segment. So before we end the show today, I wanted to just tell you a little bit about one more really amazing advancement for spinal problems. And then I'll dive into it a little more at the beginning of next week's show. And that is cold laser. Cold laser therapy uses a non-heating laser device, meaning it doesn't burn you like tattoo removal. It's completely pain-free, but it improves circulation. It stimulates repair, And so I wanted to cite for you a few clinical studies of the known biological effects of laser therapy. And you tell me if you think this might be a benefit of someone with spinal problems. Number one, it accelerates tissue repair. Of course, that would help someone with spinal problems. Number two, it reduces fibrous tissue formation, which is scar tissue. Almost every spinal problem out there, there's scar tissue that's involved, and cold laser can help reduce those fibrous, tough scar tissue areas. Three is it's anti-inflammatory. Almost every spinal problem has some level of inflammation. And number four, it has analgesic properties, which means it reduces pain through a COX inhibitor. So it can help with the pain. And number five, it improves vascular activity. So you get more blood flow to the area. And blood flow means oxygen, and oxygen means healing. And number seven, it reduces trigger points. And a trigger point is a little area of muscle spasm that you get in a muscle that's like a little marble in that muscle. I know you guys have these knots. You call them knots. That's a trigger point, and the cold laser can reduce those. All of these are amazing benefits of cold laser, and it's completely pain-free, and it's completely harmless, and it has amazing benefits. And so keep in mind, guys, not one of these things by itself is generally going to be enough to correct your spinal problem. But if I do 5 things to you to try to help you with your spine, and each one of them we just get 20% results on, we're 100% there. We don't have to hit a home run. We just have to figure out 5 things we can do to try to help 20% with each one of those. Now, let's say that I recommend that we do 5 things, and 4 of them, well, one of them is an absolute bust, and I was way off in left field, and it didn't help you at all. It was a waste. And the other 4 helped you 20%. You're 80% better. Even if we do miss one, you're still 80% better. People suffering with chronic spinal problems would love to be 80% better. Most of them would love to be 50% better. So we don't have to find this magic bullet. We don't have to hit a home run every time with your treatment. We don't have to be right every single time we look at something. We just have to put a program together that uses some of the very latest research backed up by some of the amazing new technological advances, surgery-free, drug-free spinal treatments. And if I do 5 things and each one of them moves us towards our goal, we can finally give you your life back. And you know, spinal conditions are the number one disabling thing in America. We have to get this under control. You know, your spine is something that if all your teeth rotted and fell out tomorrow, you could get a brand new set. But if just one of your vertebrae goes bad, you could become disabled. You can't lift your grandkids. You can't go to work. You can't hunt and fish. All those things that we love to do. You have to have your structure intact in order to do those things. And I see so many people that have ignored their spinal problems to the point to where now it's too late and they're just doomed to a life of suffering. And I don't want that to happen to you. So I'm going to be hosting a free community workshop February 21st at the Hilton Garden Inn called 5 Secrets to Solving Your Pain for Good. You can call 837-7174 to register. That's 837-7174 to register. Every participant, I'm going to give them a $200 certificate towards a spinal screening. And you know what that $200 are going to cover are those gravity-bearing motion study radiography that we talked about earlier on the show, where we can actually see how your spine functions on the inside. So you have absolutely nothing to lose. Now, in New Iberia, their number is 367-2567, or simply text the word pain to 77453, and your number is going to pop right up on my computer Monday, and my staff will call you and reserve your seat. I want you to bring a friend with you. Bring somebody else out there that has spinal problems. Reserve 2 or as many seats as you'd like. Thank you guys for listening. We're going to have spinal problems all month long, and then we're going to follow it up with our workshop on February 21st at the Hilton Garden Inn. That number again was 837-7174. Thank you for listening. More on lasers next week.